Flexibility exercises are very important because they allow your muscles to move at a greater range than what they normally move. So it helps improve your range of motion. You get better posture, you get better coordination, better ability to balance. Breathing improves, your circulation throughout your body improves. The alignment of your body and your spine will improve with greater flexibility, and your performance improves. Now, performance can be improved in your everyday household activities, your work-related activities, or athletic abilities. There are 3 basic types of flexibility exercises. The first being static stretches, the second being PNF, or what is called proprioceptive neuromuscular facilitation, and the third type of flexibility exercises are foam roller exercises, which are really quite popular. For a little bit more in-depth information about the 3 different types of flexibility exercises, please refer to my blog, where I have a write-up on each of these exercises and I explain them in greater detail. The key thing to remember when you are doing flexibility exercises is develop a regular practice of them. Now, for those of you who have furry little friends, meaning cats and dogs, you'll notice that whenever the cat or dog sits up or stands up or sits down, they're always stretching throughout the day. And that's something we as humans need to do as well. We need to make stretching a part of our everyday activities. So try to develop a regular practice. Try to make sure that when you are doing your stretches, you have time to relax and you have time to do them and you're not rushing through them. When you're actually going through the process of the stretches, close your eyes if that helps you relax a little bit or go further into the stretches. But whatever you do, don't push your body into a position of pain. You want to stay in a pain-free range of motion. Those of you who have had recent acute inflammation, or you have an infection, or you have a broken bone of some sort, you might want to avoid stretches until you're advised otherwise. The most important thing about stretching, flexibility stretching in particular, is when to do it. Some will say before, some will say after. I always recommend to my patients, make sure that you are doing stretches after your body has been warmed up. So at the very least, do 5 or 10 minutes of activity to warm up your body, to decrease some of the muscle tension, to increase the temperature of your body and loosen up your muscles. So I recommend cardiovascular exercises of some sort, like going on a treadmill, elliptical, going outside for a run or a jog, or you could even do the active range of motion exercise videos that we have in our active range of motion playlist. But make sure your body has been warmed up. You should do a little bit of stretches, like active movement stretches, before you do activity, but do better, more quality, in-depth stretches after your activity. But that's very, very important. Like always, before doing any type of physical activity or exercise program, please consult with your medical doctor or your healthcare provider before starting them.